everyone. This is Lisa Haven, and I've got an urgent alert to share with you guys today, specifically in regards to what's coming within the next couple of years. Now, here's my headline: Mass influx of disease and pandemics about to knock America out cold. And this is specifically in regards to Obama and John Kerry's idea to allow in about 100,000 refugees by 2017. Now, let me just read to you the quote out of the New York Times. I'm going to leave a link below. This is specifically about the refugees, and it states the Obama administration will increase the number of worldwide refugees the U.S. accepts every year to 100,000 by 2017, a significant increase over the current annual cap of 70,000. And that's according to the Secretary of State, John Kerry. And that was on September 20th of 2015 that statement was made. And again, I'm going to leave a link to that. So if you want to check it out, verify it. But here's the kicker. Obama plans, obviously, on letting more than 70,000 in a year. Otherwise, that number wouldn't have went from 70,000 to 100,000. They're already allowing them in, and they're about to let them in boatloads, and we are in some serious trouble. I showed you the other day in a report that the government was going to start pushing undocumented citizens in our schools. I'll also leave a link to that video, but it's one that I created just yesterday, one video back. But on that document, Obama tells schools they have to accept undocumented immigrants, those without birth certificates, those without social security cards. And he even recommended, the administration recommended, that they have an undocumented week or an undocumented holiday for these people that are going to be coming in. Imagine the impacts that will have on our school system alone. Now, that aside, because I don't want to re-get into something that I spoke about before, but keep that in mind, okay? So refugees are definitely going to be coming in by the tens of thousands. I believe that. And the more and more, and they're already coming in, but he wants 100,000 a year by 2017. That's going to be their new cap. This is going to implode our economy, and they know it. Now, let's look at what immigration is doing at this moment in Germany, because I'm going to show you first and foremost a letter from a physician woman in Germany. Let's just go there. All right, here we are at therightscoop.com, and I'm going to leave a link to this, but there's also a video, and what this is a whistleblower doctor explains the horrific reality dealing with Muslim invaders in Germany, okay? Now, I'm well aware of Snoops. I like to call it Snoops because that's what they are. They're a Snoop, or Snopes is the real name. I know the difference. I know it's Snopes. But the reason I call it Snoops is because I hate the company, I hate the organization, and they lie out their freaking teeth. Anyway, that said, this is a letter on Snopes. It's claiming that this letter is unprovable, which means they can't say yes or they can't say no. Now, here's what I'm going to do. I'm going to let you make that decision after I show you exactly what's happening in Germany according to other news sources, and then also this letter, because they all line up. And that's the idea. When things line up, then you know then you know that you get the overall picture of what's going on. But there's also a video here that you guys, I would encourage you to watch. It's actually from a Chesnian doctor who works in a German hospital, but it was aired by a Chesnian news company. Okay, that's where the original came from. Now let me scroll down to the verbiage. Now here's the letter, and I encourage you to come and read it off the site. But it says, a friend in Prague has a friend who has a retired physician and returned to work at the Munich area hospital where they needed an anesthesiologist. I corresponded with her and she forwarded me the email. Yesterday at the hospital, we had a meeting about the situation here and at other Munich hospitals and unsustainable clinics cannot handle emergencies. So they are starting to send everything to the hospitals. Okay, in other words, there's an influx going on in the hospitals and there's a problem. Many Muslims are refusing treatment by female staff. Let's pause right there. That's a fact. In Sharia law, they don't believe a woman is above a man. So a woman can't do anything above a man. So here they are refusing treatment. 100% fact. That that goes along with things that they believe. And she goes on to say that, and we women are refusing to go among these animals, especially from Africa. Relations between the staff and migrants are going from bad to worse. Since last weekend, migrants going to the hospital must be accompanied by police with canine units. Many migrants have AIDS, syphilis, open TB, and many exotic diseases that we in Europe do not know how to treat. If they receive a prescription in the pharmacy, they learn they have to pay cash. This leads to unbelievable outbursts, especially when it is about drugs for their children. They abandon their children with the pharmaceutical staff with the words, "So cure them yourselves here." So the police are just guarding the clinics and hospitals, but also large pharmacies. So you have police in hospitals, police at pharmacies. Truly, we said openly, we are the ones who had welcomed in front of TV cameras with signs at translations. Yes, for now, the border has been closed, but 1 million of them are already here, and we will definitely not be able to get rid of them. Until now, the number of unemployed in Germany was 2.2 million. Now it's risen to 3.5 million. Most of the people are completely unemployable. A bare minimum of them have education. What is more, their women usually do not work at all. So who relies on that burden? Well, if this happens in America, that's going to be taxpayers. I'm also going to prove that to you. I estimate that 1 in 10 are pregnant. Hundreds of thousands of them have brought along infants and little kids under 6. Many emancipated and neglected. If this continues and Germany reopens its borders, I'm going home to the Czech Republic. Nobody can keep me here in this situation, not even if it's doubled the salary than at home. Even the professor who heads our department told us how sad it makes him to see the cleaning women who for 800 euros clean every day for years, and then meets young men in the hallway who just wait with their hand outstretched, want everything for free, and when they don't get it, they throw a fit. I really don't need this, but I'm afraid that if I return at some point, it will be the same in the Czech Republic. If the Germans with their nature cannot handle this, there is Chechnya, in which will be total chaos. Nobody who has not come in contact with them has no idea what kind of animals they are, especially those from Africa, and how Muslims act superior to our staff regarding their religious accommodations. It goes on to say, for now, the local hospital staff has not come down with the disease they brought here. But with so many hundreds of patients every day, it is just a matter of time. Now, it goes on to talk about knives and being stabbed and whatnot. You can come and read the rest of that letter. But this is kind of the imperative part. Wow. So as you can see, specifically in regards to that letter, she said there's mass immigration coming in. She said the Muslims are refusing treatment from the women, which goes along with Sharia law and their belief on women. And then she goes on to say that they're bringing in a mass influx disease and we're having problems in the hospital. Now, are there any other news reports to back this up? Let's go there. Okay, here's our first one, dailymail.co.uk. It says, Germany in the state of siege. Merkel was cheered when she opened the floodgates to migrants. Now, with gangs of men roaming the streets and young German women being told to cover up, the mood is changing. We also know that in Germany right now, they're making it basically, you can be 29 days in jail or you can get a euro fine just for simply saying something against immigration. This is why that letter was not allowed to go viral. Now, the other thing is the media is told to kind of keep it on the hush hush as well. And this is what they're doing. But thankfully, some of this is leaking out. But this is one among many articles. Let me just go show you a Google search here. And I encourage you to do this. Here, go Germany crisis immigration. And when you do this, you're going to see migrant crisis get tough. Migrant crisis awakens Germany from slumber. Germany struggled to ward off panic over migrant crisis. Doctors outrage at refugees pushing German hospitals to the breaking point. Okay, hospitals, that's on express.co.uk. Hospitals being pushed to a breaking point, yet Snoops, whatever, wants to claim it's undeniable. We don't know. That's because it's a freaking Catwoman doing it out of her house. okay, who has nothing to do with the do, and she works hand in hand with the government, I'm sure. Europe's migrant crisis not giving us, like in Germany's small towns feel the cost of Europe's migrants. Migrant crisis, look, this goes on. This goes on and on and on. You can go through pages of these reports. So is the woman's letter verifiable? You betcha. Now, with that in mind and the fact of what I shared at the beginning of this video, let's go here. Now, this is important, and if I can fix the screen. Here we have www.fairus.org or fairus.org site. Now, this is a report that was put together in 2009 when I said I was going to prove to you the immigration crisis and its effects it's going to have in America. We already see what it's doing in Germany, and prove to you that we're about to get some pretty major diseases and stuff coming to America. Well, this report was put together by Eric Ruark, Senior Research, and Jack Martin, Director of Special Projects. This is back in 2009. Federation for America Immigration Reform, the sinking lifeboat. Now, this entire document, and it's not that large, it's definitely readable, but it basically is about the immigrations, how none of them have insurance, or a majority don't, obviously, because they don't have Social Security and they can't get it, okay? And then it says how because of that, they go to hospitals, they require treatment. Hospitals are forced by law to treat the immigrants. And then the federal government is supposed to give money to the hospital to pay for that treatment, right? That's the way the cookie crumbles. That's the way it's set up. But the problem is the federal government hasn't been giving the money to the hospitals. But either way, here's the kicker. Me and you are footing the bill. I'm paying for these immigrants. You're paying for these immigrants to get medical care. Meanwhile, we're paying for ourselves as well. It's just a big, big problem. But this puts and sheds light on the crisis. And here is the executive summary. America's healthcare system is in crisis. Cost and insurance premiums are skyrocketing, and the number of the uninsured is rising rapidly as millions of Americans are losing their jobs. Providers are reducing staffing and services and are increasing rates, and hospitals are closing or are facing bankruptcy into the deteriorating situation. The Obama administration is boldly striding in an effort to extend medical insurance more widely to the uninsured, a key issue of the cost of expansion, and that cost will influence the large amount of coverage that becomes available to immigrants, including illegal aliens and their children, a sizable portion of the uninsured. It goes on to say down here, as states grapple with the current budget deficits, they are cutting their healthcare budgets to try to make ends meet. But they are limited by legislation from making certain cutbacks in emergency medical care that would ease some of the strain that is caused by the high level of immigration usage, especially by illegal aliens. What is most frustrating to the public, federal, state, and local governments refuse to collect the information that would expose just how expensive healthcare to immigrants actually is. This is going to blow up our healthcare system, you can betcha, and how quality and availability of healthcare to American citizens is going to suffer because of it. That's a huge, huge, huge statement right there. All out evidence that we're going to suffer. Now, it says federal laws require hospitals to treat anyone who enters the emergency room, regardless of the ability to have to pay. Have created an unfold mandate. States and localities may not deny emergency care to the uninsured, regardless of their immigration status. The problem of emergency care has grown to enormous proportions because of lack of enforcement of federal laws against illegal immigration has led to a pool of 13 million illegal aliens in the United States. That is a big number. That's a number we are paying. We're footing the bill, and state and local taxpayers are being forced to foot the bill. Although immigration law enforcement is a federal responsibility, most hospitals receive little to no reimbursement for the care to immigrants that the federal government mandates that they provide. So again, the hospital has to provide it. We pay the bill, but the government's not sending the money, right? Therefore, our hospitals are going down the tubes. The government knows that. They know it. They're doing it on purpose. That was the purpose of Obamacare, to explode our healthcare system. But it just gives a few details here. I want to take you now to page 5. Who pays for the immigration? Well, we do. We do. You saw that above, but under the law, hospitals have to treat and stabilize anyone who seeks emergency care. Yet, most hospitals receive little reimbursement. Again, it just reiterates that. Although that act, the IRA Act of 1996, approves reimbursement for hospitals for emergency care, as well as reimbursement for state and local ambulance services provided by illegal immigration, neither program has ever been funded. Interesting. Why? Maybe they want to implode our economy. Let's scroll down. Here's about Medicaid and Medicare. Immigrants most likely to be uninsured. That's an obvious fact. Now let's go to a statistic here. You guys this is not good. Now keep in mind, less immigrants in 1990 and 2008. Now we have a bunch more. Think of what this is going to do to our system. So keep that in mind. Between 1990 and 2008, more than 70 emergency rooms in California closed. Sacramento hospitals experienced more than 6,000 hours of ambulance diversion in 2003 due to overcrowding. In 93 and 2003, LA saw its emergency room decrease by 26%, and 1 out of every 4 ambulances in the LA County was diverted. In that same year, almost 1 in every 10 hospitals nationwide was in diversion status 20% of the time. The rapid escalation in losses has created an enormous burden on the remaining emergency departments. Reports the California Medical Association. The drain on the system has led to longer waits for treatment. This is also not only because of the immigration are we going to have longer waits, but also because of Obamacare. Okay, not only that, but it has left entire communities without a local emergency facility. It increased patient volume, and a decline in the number of emergency rooms has made multiple hour waits for emergency care the norm. Multiple hour waits for emergency care. There's your proof. There's your proof, all found in this study. And then I found this quote interesting. As Jeff Spade, vice president of the North Carolina Hospital Association, states, the burden of the uninsured immigrants is huge. It's exploded the amount of work that hospitals have to do. And they give a few statistics right above there. Then it goes on to say the skyrocketing costs and closing hospitals. It says the lack of insurance leads many immigrants to forego or postpone medical care, especially preventative, because this can cause conditions or deteriorate it. It often ultimately increases the cost of treatment. Many migrants end up using hospital emergency departments, the most expensive source, as their primary care. So instead of going to a doctor, they know they get free treatment from emergency. So they go straight to the emergency room where it is triple and most expensive than any other emergency care out there. And we're footing the bill for this. As a result, we have skyrocketing prices of healthcare and closing hospitals due to the amount that they're not getting paid from government and the like. Now it goes on here on page 8 to make the question of preventative care and how a lot of the times the research does not bear out, and it kind of gets into detail there. I don't want to focus too much on that. Crisis along the border. Now here it goes into a few of the states about, here in Arizona, foreign-born population is 15.6% of the state's total population. That means there are 500,000 illegal aliens in Arizona alone. Now, the problem that's causing to our health system currently is a big issue. And these are numbers from 2009. Here we are in 2015. It's a lot more. And this is why we've seen an uptick in healthcare cost. But then they go here to the price of citizenship, where at one time, the Arizona Daily Star profiled the birth package that they offered Tucson Medical Center, where they would say, okay, recruit wealthy Mexican women to come to the U.S. and deliver their babies. Pregnant women can do a C-section a couple of weeks before their due date, yada, yada. And the maternal package is raised from $2,300 to $4,600. Here's the problem. Me and you pay $8,000 to $11,000 for something like that. So who's footing the bill on that? Okay, well, so rich women from Mexico come, and this is what they pay. and we pay 8 to 11,000. And again, the hospital is saying who is paying the bill for the remainder of these costs of birth. So it gets into California statistics, Texas and Florida and Nevada, all the different statistics here that you can look at. I don't want to get into all of that. But public health care has been basically ignored, especially in regards to immigration. That's kind of the gist. Now, there's more in this packet, but you can come and read it for yourself. Now, what implications will this have on the U.S.? Well, we saw in 2009 what immigration did. Imagine by 2017, when we've got hundreds of thousands of them in our country, what will that do? And I think Idaho has a picture of what can happen, because here I have idaho.gov, laboridaho.gov or whatever. We have Human Resources hiring an Ebola coordinator. Now, why would they hire an Ebola coordinator? Why? Well, because I do believe they know that when an influx of immigrants come to this country, we're going to have more and more problems. Just something to keep a lookout, but they're definitely hiring somebody, and there's a reason for it. You don't hire somebody and pay them $23 an hour to deal with Ebola. Why? Unless you foresee something coming. Well, that is exactly. Now, and I wanted to have time to go to different state websites and see if anybody else is hiring like that. I didn't have the time to cover that. But if you get any links like that, please leave them below. Either way, I'm going to be keeping an eye on the CDC website as well. Here is a summary of infectious diseases that they put out on October 22nd, just kind of a heads up, so to speak. Maybe they know something as well. Anyhow, I didn't want to make the video this long. I was going to try to keep it under 20 minutes. Now I'm a little over, but I wanted to bring all this to you because I do foresee a mass influx of disease and pandemics. It's happening in Germany. It's happening in Europe. It's about to happen in America. Not only we're going to have an influx of diseases when they start coming into our country, but we're also going to have the problem with our healthcare. Longer lines, longer wait times. They'll be denying people. Who knows how bad it will be. Hospitals will close, as we've seen in California take place as a result of some of the mass immigrations that we're footing the bill for. They're going to the emergency room for a cold versus to a doctor. We're paying that. They're going if they hurt their finger because they can get free care at the emergency room, right? But at your local doctor's not necessarily so. So that's the problem that we have. And not only that, but it's going to drain our economy. We saw in Germany via the letter that more and more jobs have been lost. Why? Because other immigrants are willing to work for less and willing to live in, less, unlike your average American who is used to working for a decent wage because they have a college degree. This is just my warning. And even in our schools, not to mention what I brought up earlier, our schools are not going to have the finances to cover these immigrants. Me and you are footing the bill for that. And, maybe this is what they're going to do. I don't know, but they could, they're going to tax us via carbon in order to make that up, or who knows? Or maybe they won't. Maybe they'll just let it blow up, because that is the ultimate goal. And I think that's what I'm seeing here. Anyhow, wanted to bring you the latest. This is Lisa Haven signing off.